Thanks for listening. If you like the candid discussion and are seeking the truth behind the mainstream narrative, then please subscribe and share. Not only am I grateful, but those who seek the truth and wish to empower themselves and their family's health, freedoms, and future will also be grateful. All right, today we're going to talk about a condition called degenerative joint disease or degenerative disc disease. They're very similar. There's not much separating them other than one specific about the disc, and the others are more relating to joints in the periphery of the body and even the spinal joints behind the disc. Any articulation that shows a calcific buildup or breakdown in that health of a joint in the bone around that joint is referred to as degenerative disc or degenerative joint disease, depending on, again, the location. So what we're going to talk about with specifics is an interaction I had with a patient just recently where there was some confusion as to what does that mean? The person had let's just say it was a female, and she had an X-ray or an MRI taken. It doesn't matter where it came from. An X-ray can show degenerative joint disease and disc disease, as the joint would be more calcific and show spurring. And there's other things that go with that, but spurs are basically the extra laydown of calcium that occurs where the ligaments and the tissues around that joint are becoming calcific because of a couple reasons, and we'll get into those reasons in just a moment. But the real key here is to help a patient understand what that means, because you're going to get an interpretation of that with your medical doctor, who is going to, and the radiologist will read it in a medical way, again, to point to the fact that they're going to state the reason this is pretty basic, and then you're just stuck with it. They're not giving you any indication as to why it's there in the first place, what you can do about it, how you can prevent it from getting further. Anything outside of drugs or surgery will not be recommended or even acknowledged, period. Which creates frustration for the patient, the consumer, who feels like they go get information from that medical model, that system, and then there's your answers, period. That's it, no more. What they say goes, that's it, cut and dry. And yet, you're left as a patient with those choices, and I reiterate choices. You are supposed to be the one with choice and options, and you have the right to seek what aligns with you in your philosophy about health. So again, the reason we're talking about this is the confusion that the patient had as to, okay, now what? They said, I have this. They, being the medical system, said, I have degenerative joint disease in this area of my spine. Particularly, we're going to talk about a transition area. It can happen anywhere in the spine, by the way. Most common areas are going to be stress points in the body. The lower back, L4, L5, the most common area is injured with disc, and most common surgical areas of the spine. Then we're looking at in the neck surgically, C5, C6 areas are also very common for degenerative joint and disc disease, because these are the primary areas where the body absorbs stress, and biomechanically they're crucial for biomechanical integrity of the body in terms of weight bearing, curvatures in those areas, and how the body absorbs stress. So when we look at this specific individual for this case, I want you to kind of pick up the magnitude of it, the importance of what we're talking about, and how it comes back to you as the chooser, you as the consumer, as to how you proceed in your life as a result of this, based on what you want to accomplish with your quality of life, what you want to move like as you continue to age, and how you actually want to realistically or pragmatically slow the aging process down, rather than just assume it's just old age, because again, that's one of the answers. So with T12 in L1 in the T11 area, this is a transition area from your mid-back and your thoracics into your low back. So if you just think of the letter S, where you make the curve from up and then you come down, and then it actually changes from one arc and you curve back the other way to make two arcs, basically, that are kind of, instead of saying two C's inverted, you're actually making an S. Well, that middle of the S curve, where you go from one direction back to the other, is your thoracic lumbar junction. That's where your mid-back curves from one curvature, and then it changes to another curvature. That S-like curve in your mid to low back, which would be defined as your upper low back and your lower mid back, that's a transitional area. It's very important in the neurology from that area. Covers the organ systems like the colon. It covers the kidneys And so basically part of your GI tract, which is the lower portion of your small intestine, as well as your large intestine. And you have a chain of nerves there that are basically, multiple sites that it controls, as well as the musculature in the spine along those areas. So the individual has had stress in that area of their spine for quite some time because I've cared for them, and we've talked about it at different times. But the interesting thing is it didn't become an urgent issue for the patient until they were actually diagnosed with a condition there. Now there's more importance. There's more investment. There's more urgency. It's more real. It's more, okay, I have a problem here. Wait, what can I do about it? I've shared it for years with this patient in terms of how the digestion and the food choices and the stress have been cumulative in the process. And we've helped the individual with pain along the way and even other health issues. But this continued to be persistent because of, again, not enough urgency to really address prevention and proactivity, but more lines of putting out a fire. And when the fire would stop symptomatically, then the work would stop. And that's not a judgment on this patient. That is not an attack. It's just the reality of how we tend to go back and take care of ourselves and what human beings do, because we're more apt to avoid pain than seek pleasure, which is bizarre, right? But you're more apt to avoid a painful situation than you are to actually go create a positive one. And you might say to yourself, well, no, that's not true. That's not me. It's true by nature that we are predictable in that way, that it's going to be more exertional to avoid pain than it is to seek that pleasure. And one of the sayings, I used to hear from Tony Robbins as an example was, when the pain of same exceeds the pain of change, then people will change. So the pain of the same thing exceeding the pain of changing, you will take action. So the pain of this being a deeper problem with health right now, very uncomfortable, very painful, it's got my attention. I'm willing to do something more about it now than when it doesn't have my attention. That's all we're saying, and that's reality, okay? And you might be different because of your painful experiences in the past, and your values may just seek wellness every day, and you're doing very positive things. That doesn't mean everyone is included. This is just, again, back to human nature. So enough of that. But in this area, there was a diagnosis of degenerative joint disease. So the patient said, so I was diagnosed with degenerative joint disease here, and it was on an MRI or CT or X-ray. And again, I just can't recall exactly what it was. It was the conversation. I haven't seen the films, which I do want to see. So the patient, I just listened, and I'm adjusting, and I'm listening, and I'm having a dialogue with the patient. And I said, so what do you make of that? And she said, I don't know. What do we do about that? I said, well, first of all, what do those areas control? And she's listening, said, I don't know, but you're going to tell me. And I said, yep. If you want to know, they're affecting things like the kidneys, the liver, and your lower digestive system, and basically absorptive system, and elimination. And there's been a history with digestion in this individual. There's been a history of deep, long-term emotional stress and occupational stress and lifestyle stress with this individual based on their experiences. So there's a side effect, and there's a consequence of the chronic stress. It's not just a generic diagnosis. It's literally the cause of additional strain on the body and what actually is the homeostatic mechanism to keep the body in balance while it's going through this perceived stress. And one of them being, which you'll hear me go over in greater depth, but the digestive process. When you are stressed and in fight or flight or sympathetic dominance, you will not digest food well. That's the natural state of the body. It says fight or flight is more important than resting and digesting. Therefore, we will fight or flight, or, in other words, not digest food, but move blood into the limbs and extremities and into the heart that needs to pump faster, into all the hormones that, like cortisol, that address the need to fight or flight or flee. And in many cases, it's literally just a survival means. So we know the stress we've been under as a population, as a human being in this world right now, with all the corruption, with all the, the health lies about, this working, that working, this group, that group. It's a health issue that's become exposed as completely political. One side believing this way, the other side believing completely the opposite that way. Both sides are right and both sides are fighting. Well, guess what? Human beings are stuck in the middle of this. And you and I are together. And I don't care what side of the aisle on, you and I are together. Now, whether you allow new thought to come in, that's up to you. And whether you're still listening means you're probably not completely in disagreement with me. Otherwise, you wouldn't be here. But I'm not here to make or have you or rather agree with everything I say. I'm here to teach. I'm here to share insight and truth based on logical thinking and reasoning instead of just buying into what the new or recent trend is. So that comes back to how I answer these questions with a patient, because my first response is to give the patient the choice to hear what I have to say. I remind them and I re-ask the question, would you like my opinion? You can say no. And you'll hear me say that over and over. Even though the patient's in my office, they're asking for help, I don't assume or presume anything. I'm asking them to re-clarify. They might have come in for this or that. Let's say it's low back pain or neck pain or whatever it is, or digestive problems or wellness. And then I'm going to ask them again and say, okay, well, here's what I'm seeing today. There's feedback. Here's what you've been told by your medical doctor based on those films. Here's what I see in your history, and here's where we can go. Would you like my help? Certainly. All right, let's do this. So that degenerative change comes from abnormal wear and tear. Cause number one, abnormal wear and tear that creates an imbalance in that joint, which creates local inflammation, which then creates a local inflammation, if it's not corrected or supported or reduced, will continue to have a pattern of stress in that region that biomechanically or joint-wise moves like that over and over and over through your life, through your day, through your sitting job, through your lack of movement, through the stress that you have, will move in a patterned way that creates destruction in that joint. That destruction over time, which is a micro destruction on a daily level, on an hourly, daily, weekly, monthly, annually, yearly, over time level, will break that joint down. There's a concept called Wolff's Law, which is, it literally applies when we look at what bone does. When bone changes, when extra bony growths appear in areas of additional stress on the body from gravity I don't want to say gravity, let's just say from weight bearing. And when we look at it from body movement, we'll simplify that phrase. But the movement of the body is crucial, and fluidity, efficiency, alignment, they're all important they're all important for the health of that joint and individual joints. So why this joint? This joint I told you specifically because there's been digestive stress on the patient for years. That has affected the bowel movements. That has affected the absorption of nutrients. Why? Because digestion was poor, living in chronic stress and chronic worry and chronic psychological imbalance, like just too much going on in the brain is a stressed mode that sends the message to the rest of the body. By the way, it's brilliant. It's brilliant because it sends the body into the phase that the body thinks it's in. So if I feel like I'm stressed and I don't have any choices and I don't have enough time for myself and I hate my life and I'm struggling with this relationship or that relationship or financially here or my job and congruency and expectations and pleasing and playing this role that I've played for so many years, do you get the emphatic enthusiasm that I have about that? Like, this is so real for people that it manifests physically, physiologically in the tissues. This area specifically relates to that particular individual, this woman's lifestyle and history. And there's more degeneration, more than likely, in that spine in other areas. But this is a primary area where there's been chronic symptoms. It's not just bad luck. And they're not just a victim. The medical diagnosis for this is commonly going to be, it's just old age, it's just arthritis, this happens as you age, and there's nothing you can do about it, you just got to live with it. That is absolutely hands down the most common answers that I hear the patient and I hear medical doctors actually say. It's not only completely irresponsible, it lacks any integrity as to why anything occurs to them. It's just, accept this as your lot in life. It's not your fault, and it's basically we can correct it with drugs, or we just wait till it's bad enough to do surgery. Nothing you can do about it. I completely disagree. You can do many things about it. Chiropractic health is about adjusting the spine and nervous system into alignment that allows the body to function more efficiently. It is not, you didn't hear me say a treatment for pain. That's not why chiropractic started. Chiropractic was founded in 1895, practice of the hands and health long before that, but the phrase chiropractic, which is the practicing with the hands for health, simple definition is the chiro stands for hand, right? The practice of. When we look at adjusting the spine and nervous system, there's a reason we're after that, which is to release interference to the system that runs the body. Thereby allows the body to physically and physiologically and biomechanically, motion-wise, mobility, function more normally, more optimally, to allow the body to adapt to its environment more efficiently, more effectively, and with greater ease. By way of relieving dis-ease in creating more ease in the body is more, it is brilliant and intelligent. It has innate intelligence within it, within every single cell, tissue, and organ system in the body. And the efficiency that happens is an onboard inside job. It's an inside, I don't care how many times you might hear somebody theorize how the body can heal, but I'm talking about reality. I'm talking about the lab of human beings every single day in my office, that my only role and job in the office is to connect that patient from where they think they are and what their body's capable of to what they're truly capable of. And that's how I see my work is, I'm not the healer. Do we heal in our office? Yeah, but I'm not the healer. The body's the healer. I'm simply the medium to get the body functioning and in balance. And I read the body. I assess the body. I know how to test it and evaluate it and understand what the body's really telling us. And then I make sense of that for the patient to teach them how to then engage in their health by understanding their body, listening to their body, making sense of what they're experiencing. So in this individual with a degenerative joint disease, she does not have to live with this the rest of her life. Now, what can she reverse? That depends on what she's capable and willing to do to change. But most cases are, we're going to just, I set up a re-exam for one, just to reevaluate and reassess, because now the patient's ready to look at this more seriously, which is the opportunity that the patient presented, rather than my need to be right to the patient long ago and hammer the patient or demand this from the patient or dismiss the patient because they're unwilling to take it as serious as I am. So I also try to meet the patient where they're at and allow them the opportunity to engage in healthcare that's beneficial and be there for them when they're ready to take a serious step into it or not, because they get to hire and fire me every single day. And I'm okay with that because I have to show up every day. When patients ask for help, it's up to me and my staff to find out exactly what they're asking and whether or not we are the ones that can help them and they're ready for our help. And so at this stage of my game, being nearly 30 years out, 29 and a half years in practice, I completely have a different energy and drive as to what I'm accomplishing than when I first started. And that's just natural, I guess, but I'm still such a student of the game. I love what I do. I do it on a little different level than I used to do it, but that's because I'm being drawn into how people want help and where they need help instead of needing to just do something one way or my way or whatever it was. It's now, and It's me adapting to what I'm being asked of, and then making choices as to how we help patients along this line, which has changed my art, which has changed my office systems, which has changed how we train, how we focus and where we focus, such as, having a phlebotomist in my office now where we draw labs because of some health experiences that both Dr. Heather and myself went through that have changed the direction of my practice and forced me to get answers in areas that I wasn't getting them again medically, and where again medically that it just falls short as to any answers to why something happens and how to prevent it or how to correct it rather than just treat it with a drug. And that's what we're coming back at with this patient, is the awareness of how this injury, this micro trauma over time caused degenerative joint disease, and then bringing her back to the point where now she's ready to listen and say and share with her, okay, these daily habits have to change or you're going to continue to create these same things. Well, the patient in anticipation may be able to say at this point, hey doc, I don't see any of that changing right now. So what can I do on my end while this doesn't, or while this can't change? All right. Because again, hard and fast rules are, okay, what can we do together or what can we do, you do? It doesn't have to be with me. I'm just saying, what can we do together to help you get to where you need to be for now until things can smooth out better and keep you working towards the true solution to this? So the first thing the patient said, by the way, when I said, what do you think has caused this? And she goes, well, I know my diet really needs to change. And I said, okay, great. Your diet does need to change. I acknowledge that without making any judgments or continuing to add a blame on that, like heavy. So I said that may be very, very true, and it is also an essential component. However, in fairness, there's multiple things here that are going on. One is the movement and the lack of movement. Two, the consistency with care that actually allows your body to be aligned more often, which means structurally it's functioning better, it's less inflamed, it's more adaptive to the stress you're under, and it's preventive in not allowing your body to keep down stay on that path where you're just drifting further and further, compensating for all the stresses, compensating less because the system's less adaptive, and now you're moving in this direction. And the clear point here is there is a lifestyle, obviously, and there is the pace with which our life demands from us. And so this mom of two and a special needs child has a lot of strings pulling on her, just pulling and tugging and tearing, right? And so she's only doing the best she can. But the problem is the spinal debt, the structural debt, the health debt is accumulating because it's not being attended to, because there's no time, there's no energy. So we want to, number one, plug the leaks of energy leak, plug the holes of energy leaks. We want to shift the digestive stress so the body is digesting nutrients more efficiently. There'll be less craving. There'll be more satiety or satisfaction when carbohydrates, proteins, or fats are being ingested. And there'll be less chasing of the things not being digested. That will create more inflammation, which will create more digestive stress, which will create more systemic inflammation and stress. So this whole inner working is an individual deal. It is based on unique. There's no cookie cutter approach. I have to look at this individual's life, assess that part, know where the stress is coming from, and then combat to the best in the top three things that are going to have the biggest impact for this individual. One, adjusted with some frequency that's going to allow her body to stay in alignment longer and feel better so she can then start holding some energy within, right? And having the energy to get through her day, and then possibly, let's say it's going to be meditation for her homework. It's going to be, yes, let's make sure you eat something in the morning. Let's make sure you're not medicating yourself to sleep or whatever that might be. Let's make sure you're getting some quality sleep. And let's make sure we're getting enough nutrients in those areas to bypass your weak digestion right now enough to get your body engaged, healing, and moving better until we get your digestive system cleaned up where you're actually digesting and assimilating food better. You're creating more healthy stomach acid in your digestive system. The mucosal membrane is allowing things to move through your body better, and there's better health there, which means there's better absorption. And now there's only a couple things you might be using, such as a digestive enzyme or a therapeutic enzyme, to help support the process that will help you maintain or support yourself better while you're going through some stress. And then we're going to work on teaching with maybe come from someone else and some focus. Obviously, better movement more often, and just the fact that that's going to help peace of mind in and of itself, and some freedom for thought and some relaxation. And then also having a way to come to terms with the stress and the role that that patient's played in their roles they've been given and or assumed or they've taken on that have now gotten themselves in this hamster wheel. And these are where we're going to actually have an impact with the patient's quality of life. And unless you're looking at all facets like this, and I don't mean I have to treat all facets, because I do not. I am not here being a therapist. I am not trying to do things for this patient where I'm into exercise and fitness, but I focus on spinal correction, rebalancing, and if someone needs some PT or some work along the lines, I'm going to send them to a physical therapist that focuses just on that. And that's perfectly okay. I'm going to focus where my sweet spot is and where I'm the expert, and let other experts help this patient in their ways. So we can move this patient along her health journey and not feel like I have to be every answer to that patient. But the degenerative joint disease and disc disease is a byproduct of, number one, movement. Lack thereof, lack of healthy movement. There's going to be a stress component in there that, whether it's physiologically through the organ systems, let's say digestion is poor, it's going to trigger that area of the spine, and then there's going to be what's called involuntary muscle contracture as a result of the irritation and stress to those organ systems. We'll get into the organ system stress and how certain regions of the spine amplify and actually express stress, whether it's musculoskeletal, from a misalignment alone, or from an organ system that's creating the misalignment. We call that visceral somatic, from organ to the muscle, body muscle, or somatovisceral, which is from the spinal area, actually creating stress to the stomach, as an example, or the heart, let's say, or the spleen, or the liver, the kidneys, the gallbladder, one part of the colon, the whole colon. It just depends on where those stress spots are. But that's also how we have an impact. When I say chiropractic, but specific adjusting will have an impact on the integrity of those organ systems. That's why it works together. They are symbiotic. They work absolutely together. And for me not to look at that for a patient and share that piece, it would be just, no, you're one-dimensionally, is you're misaligned there, and we just have to keep adjusting that misalignment until it, for the rest of your life. To me, that diagnosis isn't any different than you're just going to have to live with it. I believe this individual can restore health, slow or stop, absolutely stop the further degeneration in that area. Not only stop the inflammatory process from a digestive point when we correct this and get her back on track, and if she goes through this daily and starts managing and supporting her health from a different perspective, like with consistency, with principled work, she's going to heal, period. That's what the body does. That's not me healing her. That's not wishful thinking. That's what the body does. You're designed for that. Are there nuances? Yes. That's where we have to break down and say, okay, this normally happens. This isn't happening. Or you're taking these. Here's an example. You're taking a non-methylated B vitamin. Well, if you can't methylate and you have MTHFR or another challenge with methylation, you may not be absorbing what you think you're getting from your vitamins, because somebody who doesn't understand methylation just throws a vitamin at you and expects your body to do something with it, or just like everyone else would do something with it. And of course, this goes for many other things, but that's also a crucial component. And that's what Dr. Heather, my wife, does. She focuses specifically in that area. That's all she's doing right now, which is phenomenal. But again, that's an up-level problem that people are finding when they've tried these exhaustive little micronutrient strategies, and they're just not getting where they need, or they're not expressing the health potential that they truly can have. So I hope this is helpful. I know there was a lot around that, but I don't have just a lukewarm opinion here. I have an understanding and actually, I don't want to say passion. I want to say I have a curious, very, very curious interest to help people understand their bodies better. I don't want to throw theory at you. I don't want to throw conjecture. I'll certainly give an opinion based on what my knowledge is over time, but I also want to back that. I want to back that with experience, and that's where this comes from. So degenerative joint disease, degenerative disc disease are consequences of many things before that. And unless you're addressing the many things before that, do not buy that you're going to have to live with this the rest of your life. We start to address those things, and you can stop that in its tracks. Medically, they give you a sentence, like literally a life sentence. You either, it's old age, it's just arthritis, you're going to have to live with it. You're a victim. You're not a victim. Stop being a victim. I'm not here blaming you either, but you are the co-creator of that. And your life experiences, because someone's never empowered you or taught you that your spinal and nervous system are crucial for your body's health and adaptability in this world, then you are always going to fall prey to a treatment to the symptoms rather than ever creating independence within your body. So if there's any questions, shoot them our way. Watch for upcoming articles on our website. We're just revamping everything, so the new blog and everything is being set up, but there'll be kind of a cross coordination of articles that go with these episodes, so more and more understanding can be sought. And I'm getting people reaching out from all over the United States and actually in other parts of the world that are hearing and still listening to this podcast. So I'm happy to share information abroad as well. But the bottom line is this: you have the potential to heal and mend. And that's, if it's not happening, then continue to ask those questions. What else can I do? Where is my body? Where are we missing this? What are we not tapping into that I'm fully capable of getting through this? So I want you to leave with that hope and that understanding. And do not take a diagnosis such as DJD, DDD, or a degenerative area in your spine, or you have a military neck, or you have the reverse curve in your neck or your lower back. We have to look at what you can do with that to minimize any further and take responsibility and accountability in restoring some balance there, whatever that may be. All right. Thanks for listening, folks. If you have any questions, shoot them to Anunson Chiropractic. That's ANUNSON at gmail.com. That's AnunsonChiropractic@gmail.com, and we will do our best to answer those efficiently or produce an episode on a pertinent topic. Until next time, be well, God bless, ciao.